Intermittent fever with swollen limbs. What could be the diagnosis? I've got a 2-year-old previously well child presented with 2 months history of intermittent fever and a recurrent self-remitting limb swelling. The spontaneous swelling involves different parts of the body like shoulders, knees and feet and is usually preceded by fever. And due to the pain, the child refused to move the affected limb. After 5 to 7 days, the fever and swelling will subside, and this condition repeats every 2 to 3 weeks with similar pattern but different limbs. Upon examination, he had a pain over the right shoulder and it was a bit swollen, but the movement wasn't restricted, and our MSK examination did not reveal any other gross abnormalities. However, we did notice that he is pale, with swollen parotid gland, multiple cervical lymph node enlargement and hepatosplenomegaly. X-ray and ultrasound of the shoulder were normal, but the initial blood test is consistent with a bicytopenia, leukocytosis with a raised inflammatory marker. The full blood picture did not show any cancer cells, but it was suggestive of infective and inflammatory process. He was treated as septic arthritis, but the other differentials were hematological malignancies or autoimmune arthritis. He was treated with antibiotic and received blood transfusion. Initially, they were counseled for bone marrow aspiration, but they were undecided. During the hospitalization, his right shoulder swelling subsided, but then he developed a new onset of a left foot swelling. Besides, the hemoglobin and platelet dropped again. They were recounseled and referred to a hemato-oncologist, and patient was subsequently diagnosed as leukemia and received chemotherapy. So what's the learning point? Whenever patient has abnormal full blood count, if it involves more than 2 cell lines, always consider leukemia. Number 2, don't be fooled by a normal full blood picture. During the initial phase, cancer cells might only be found in the marrows but not in the bloodstream. Number 3, parents need to understand bone marrow aspiration. Even though it sounds very scary, but it is diagnostic, and without a proper diagnosis, a proper treatment cannot be given.